As you all know, we've had a whole morning and part of the afternoon on our public meeting, the Integrated Care Board for North East and North Cumbria. And then this is purely on the matters on the agenda for the annual general meeting. And the purpose of the annual general meeting is to present our annual report and accounts for 2022-23. And the report's slightly different for this financial year because we only came into statutory being on the 1st of July 2022. So the annual report is covering that date up until the 31st of March 2023 for the ICB. But the period 1st of April 2022 to 30th of June 2022 is covered by the former clinical commissioning groups, of which there were 8, as you know, in the North East and North Cumbria. And so links to all these reports and the ICA report are in the papers and on the website. So if we could start with the highlights of 2022-3 looking forward, and we have a presentation and a video from our Chief Executive Sam Allen and from Claire Riley, who has prepared a lot of the video work, I think, or been responsible for that, Claire. So go ahead.
Thank you, Salim, and good afternoon, everybody, and particularly warm welcome to those colleagues in the room that have joined us from partner organisations and patient and community representative organisations. It's really good to have you with us here today in Durham. So, yes, Salim, our communications team has supported not only our campaigns, and whilst I know this is a bit of a look back, but I would highly recommend our campaign at the moment around promoting vaccinations across our communities. But certainly one of our highlights of our first year was the awards our communication teams have won for the campaigns that they've run around promoting population health across our communities. So I'm going to start, Salim, just with a brief video, which is an animation that we did share on our first anniversary, which was the 1st of July this year, just covering some key points from our first year.
A year ago, we created a brand new NHS organisation called an Integrated Care Board, or ICB for short, with a £7 billion budget and 3 million people to look after across the North East and North Cumbria. It's been a busy first year. Early on, we set out our key goals, which are at the heart of everything we do. Longer and healthier lives for all, fairer outcomes for all, better health and care services, and giving our children and young people the best start in life. Let's see how we've been living up to these ambitions. Working with partners, we have improved access to primary care services with more after-hours GP appointments and new technologies that have improved triage and telephone systems. Working with our pharmacies, we have developed more services that people would have traditionally gone to their GP for, including treatment for urinary tract infections. We have seen good reductions in hospital waiting times, and we're providing extra support for people from clinically and socially vulnerable groups who are waiting for surgery, so they have the best chance of a good outcome from their procedure. And we've also been working together to improve the transfer of care for patients when they are ready to leave hospital. With 2.3 million jabs given, we've delivered our biggest flu and COVID-19 vaccination programmes. We've strengthened how we work across the NHS, councils, community and voluntary services, hospices and many more. Joining forces like never before, we've created a new health and care partnership with an ambitious 3-year plan to tackle health inequalities and causes of early death from alcohol, obesity, heart disease, substance misuse and suicide. We've also match-funded local councils to support quit smoking programmes, one of our region's biggest killers. And we have continued to innovate and do things differently, with a new health and life science pledge and plan to create a northern diamond of innovation and research. and a new learning and improvement community, Boost, securing $250,000 from the Health Foundation to bring people with a passion for improvement, innovation and change together so we can be the best at getting better. We have launched a plan to become England's greenest region by 2030, recognising that a healthier planet means healthier people. And we're investing £35 million over 3 years to improve the health of some of our most deprived communities. Our new involvement and engagement strategy will ensure that the voices of our communities continue to be at the heart of everything we do. We are also playing our part to get more resources for our region, not just for health and care, but for wider economic and social development. Thank you to everyone who has supported us in our first year. Together we will continue on our journey for longer and healthier lives for all across the North East and North Cumbria.
So thank you for that. So that was just a short film capturing some of our highlights from our first year. And I think as I sit here today, we are only just over a year old, having been born on the 1st of July 2022. And I just want to, before I sort of talk a bit about the year ahead, I just want to take this opportunity to thank all of our partners, our local authority partners, our community and voluntary sector partners, all of our collaboratives that work across the North East and North Cumbria, our academic institutions and our public sector partners for all of their support over our first year. It is no mean feat taking 8 organisations, bringing them into one, constituting a new board and setting up the infrastructure required for the Integrated Care Board. So we absolutely could not have done it without all of the support of all of our partners and their generosity. And I also want to take this as an opportunity to thank my team as well, who were all newly recruited back in the spring last year. And I think they probably will describe it as a year like no other, setting up the organisation and establishing our working relationships and our partnerships right across the system. So when we look to the year ahead for what we do here at the Integrated Care Board, our core purpose is around improving the health of the population and also tackling health equity. We know that we have those deeply embedded health inequalities right across our region. So if we want to achieve one of our goals, which is about fairer outcomes for all, that means making sure that the way we're set up and established enables us to meet the needs of all of our communities, whether it's our most rural communities, our inner city urban communities, coastal communities. And in looking at this, we often look at the quadruple aim. So one of the really well-known models across healthcare is something called the triple aim, the core focus around improving the health of the population. And in doing so, actually, how do we use all of our resources that we've got? So that's our people, that's our buildings, our infrastructure, our evidence, our data, and how do we improve the outcomes of people who use services? And quite often, if you are really focused and you are improving the health of your population, you're using your resources better and you're driving better experiences and outcomes for your population. However, one of the things when the triple aim was used was everybody said, well, what about the staff, the health and well-being of those who provide and support care? And here across the North East and North Cumbria, we've got a workforce of 170,000 health and social care workers. We are the largest employer in the region. And actually all of the evidence we know is if you don't look after the health and well-being of your workforce, you won't be as good as improving the outcomes and experiences of those people we're here to care for. So here at the North East and North Cumbria, when we're looking at population health and all that we do, we really try to focus on it by using the quadruple aim. So, of course, one of our big highlights in our first year has been the development of our integrated care strategy. Now, back in July last year, when every one of the 42 integrated care boards in England was tasked with developing their integrated care strategy, given our size, we know we're one of in the top 5 in terms of scale of integrated care boards. One could say actually the task was a lot tougher. And I think as the chief executive leading the organisation, it was a daunting task actually. How are we going to develop a plan for the 3.2 million people that live across the North East and North Cumbria that actually is co-produced with our population and our partners. And of course this came at a time when each of our local authority partners, they have established health and wellbeing plans in their local areas. So we have one for Durham, here in Durham for the County of Durham, one in South Tyneside, one in Northumberland. I could go on. I have to say, again for me, one of the real, I think, strengths of our region is the way in which people come together. And I think one of the things we learned and we found is, in spite of the differences, and there are clear differences in our population and their needs and the priorities, there's a lot more that unites us than divides us. And therefore, through a very carefully led process of co-production, working jointly with our partners, and this was co-led by Jacqueline, our Director of Strategy and Operations, with Jane Robinson, who's the Director of Adult Social Care here in Durham, designed a process which brought all of our partners alongside us and our elected members across our councils. And the strategy that was developed was widely consulted upon. And as a result of the consultation, we did make some changes. And I think probably for me, one of the biggest messages that came back through that was the importance of giving children and young people the best start in life as a priority area. So our integrated care strategy for the North East and North Cumbria, we have 4 key goals: longer and healthier lives. And in doing so, we do want to reduce the gap between how long people live here in the North East North Cumbria compared to the rest of England. We know, and it's not across every part of our region, that given those health inequalities, the years of quality of life lived and also life expectancy isn't as good as when you look at the average in England, or indeed the best. So we want to tackle that. We want fair outcomes for all, and people's outcomes shouldn't be determined by their postcode, their quality of housing, their opportunity in life around education and employment. So we do want to make sure that we are tackling particularly those parts of our communities which are more disadvantaged, and we can bring up those outcomes for our population. Health and care services and the quality of them. So that's everything from general practice to our hospital services, to our highly specialised services, but also our care home providers. Actually, how do we have better health and care services? And as I said already, enabling our children and young people to thrive, have great futures and improve the lives of the generations to come. It's not to say that frailty and adults and older adults isn't a priority, but the overwhelming message we had across our region was that that should be our 4th goal, which we really do focus on, and I think particularly felt through the impact of the pandemic on our children and young people in terms of both their predominantly their mental health, but also their physical health too. So how do we do that? Actually, we spent a year of planning. We've got our integrated care strategy now, and we also, and I have to really acknowledge the input of our Directors of Public Health in this, we've got, I think, stretching, ambitious yet realistic and achievable outcome measures that take us up to 2030 for us to focus on. So improving services in the year to come, of course, there have been some things that have changed for us in the first year. So whilst we were constituted as an integrated care board back in July 2022, as I said, throughout our first year, like other integrated care boards, we've also had further responsibilities delegated to us. So we are now the responsible commissioner for pharmacy services, for optometry services and for dental services. And in taking on those responsibilities, we've got a real opportunity to, again, tackle some of the challenges that we know have either been long-standing and or further exacerbated by the pandemic. And as an integrated care board, we've already gripped the issue around dental services with our immediate dental recovery access plan, and we currently are working on the same for pharmacy and optometry. We do have more responsibilities to follow, and we are in ongoing dialogue with NHS England about taking on responsibility for specialised commissioning. And I think as the Integrated Care Board and the Planner and the Commissioner of Health Services, again, we do have the opportunity to better join up and plan for those local services here in the North East and North Cumbria. So how do you take an integrated care strategy that sets ambitious goals that we want to achieve, a clear vision, better health and wellbeing for all, those 4 priority areas and the outcome measures? Well, we've just this morning as an Integrated Care Board signed off what we call our Joint Forward Plan, which sets out the NHS's role in delivering those and how we're prioritising those. We also are working closely with our colleagues in the combined authorities across the region and looking at the opportunities that public sector reform beyond health can afford us. And of course, none of this would be possible, or I think the goals we set ourselves would be achievable if we weren't doing it jointly with all of our NHS providers. And here in the North East North Cumbria, we have 11 foundation trusts. It's fantastic that here at our Integrated Care Board, we have those represented as partner members, and their role is going to be absolutely pivotal in working alongside us and making sure that every contact, every opportunity, every time we come into contact with a member of our local population really counts, whether that's through an urgent treatment centre or a community mental health service. I think equally though, when we look at the weight of contacts, we know that the vast majority of services are delivered by general practice and primary care. And I have to say again, I think in our first year, we can take little, if no credit for the quality of our general practice services. I think we have to absolutely acknowledge and thank our general practitioners, our primary care services. Here in the North East North Cumbria, again, we are fortunate to have some of the, I think, best access measures in terms of access to a GP within 2 weeks, in terms of face-to-face contact, above the England average. So unlike some of those outcomes, I think that's a demonstration of how hard our general practices are working. And they've not only recovered their pre-COVID activity, they've exceeded it as well with those contacts. So their role in this, and again, we're very fortunate here in the board to have our partner members from primary care around the table. And in our first year, we have set up across the integrated care system a collaborative specifically for our primary care partners. So that's our general practice, pharmacy, optometry and dental services. So partnership working is absolutely going to be at the core of how we're going to deliver those improved outcomes. We cannot do this on our own. Equally, managing our resources well, and I will leave the presentation on the finances to our very able finance director, David Chandler, who is following me. But I just wanted to say a little bit about some of our unique challenges in the region. So I've talked already about the healthcare inequalities, and here in the North East North Cumbria, when we look at the needs of our population, of the 3.2 million people and the budget of over just 7 billion, we know that we have some of the greatest challenges nationally. And part of that is also compounded by a population that isn't growing. So unlike other parts of England, we don't have an ageing population, and the NHS funding formula, that's called the Cahill formula, is very weighted towards ageing, growing populations. Our population has a more chronic disease burden, is living shorter lives, and for some, longer in ill health. So when we look at things like our prescribing, when we look at the long-term conditions and the prevalence of it, actually the cost of healthcare here is higher, and yet the funding that we're allocated is reducing year on year. So the challenge for us as a region and some of our complexity is how do we plan and shape resources and not only meet the treatment need in the population, but also help us to tackle the prevention aspects as well. And this is well known. It's one of our particular challenges. And I think from our geography, I think one of the best things, one of the biggest opportunities we've got about being a large system is the learning that we can do and the sharing and the sharing of the use of resources. But meeting the needs of an urban population and a rural population requires two different approaches, and it's important we meet everybody's needs. So in terms of managing our resources, we need to do this really wisely. And if we think about that quadruple aim, we've also continuously got to be supporting our workforce. Now, actually, when you look at our workforce and you look at things like sickness, actually we do pretty well. And you consider in terms of those health inequalities will be prevalent in our workforce as well, but actually we do pretty well. In our first year, we have, like every other integrated care board, been set quite a challenging ask, which is reduce how much it costs you to run the organisation by 30%. And whilst we covered this at our board meeting this morning in some detail, I will just touch on this again for those people who are joining us for the annual general meeting. We currently spend less than 1% of our total operating budget on running the Integrated Care Board, and removing 30% equates to about 17.6 million. So if you think about the size of the workforce we have to run the Integrated Care Board, it will have to reduce. And we are actively working with all of our staff at the moment around a process by which we will be doing that through to the end of March. But it will mean fewer jobs, and it will mean working differently. So as an integrated care board, we will be looking at where our teams are, how they're working with partners, and actually where we can reduce duplication. The broader system of financial challenges I've touched on, and equally within that, working with our NHS partners in terms of the total NHS budget and how that's utilised is absolutely pivotal to all we do. We don't plan in isolation. We do need to continue to work closely with our NHS partners on both our short-term and our medium and long-term planning, and that includes all aspects of finance, whether that's revenue and what we can spend on the workforce, but also capital and where we're investing in things like digital and our buildings. And this will require everybody to work more together. And again, this morning we've been hearing how two of our NHS organisations on Teesside are collaborating, and this is all about how do we have a sustainable NHS given the challenges we're facing, and indeed every public sector organisation is facing with issues linked to the cost of living crisis. So of course, at the heart of everything I've said and that quadruple aim is learning. So we could have as a commissioning organisation, approach which is very arm's length, very much looking at how we're using data to assess needs. But the big opportunity we've got is how we all work better together. How, when we look at the performance across the health and care system, the system is learning from one another. So when you go through and look at the integrated performance report that we've developed in our first year to look at the performance of the NHS services, you'll see some warranted variation because of things like rurality or urban models of care, but you will also see what we call unwarranted variation. So how are we taking the best bits of the system and learning from others? And I'm, again, really proud in our first year that we have developed our approach to learning and improvement. We've established a learning and improvement community. And whilst this is looking at the first year, and I'm sure Boost will feature much more heavily in our next year's AGM, to establish a learning community with over 500 members drawn from members of the public, patients, people, residents, our professionals from right across the North East North Cumbria who are coming together to work on some of our biggest challenges. I think, is going to be what will enable us to tackle some of those greatest challenges we face. And the reason why is because we know that the vast majority of the solutions to the challenges we face rest in our communities, rest in the people doing the actual work. So our connectivity to those is absolutely crucial, and delighted we've been hearing this morning. We'll be having our Children and Young People's Mental Health Summit in October, which is bringing that community together to work together to identify how we can tackle some of the challenges we're experiencing for children and young people's mental health at the moment. So quite simply, if we were to say there was something we wanted to be known for here in the North East and North Cumbria, it would be being the best at getting better. Not being the best, because if you view yourself as the best, you're not learning. And actually, for us as a system, if we can demonstrate that we're continuously improving, and we are the part of England that's improving our outcomes and also the performance and the experience of our health and care system, and we're a good place to work, then that will be probably one of the biggest things that would make a difference to our communities. So, Chair, I'm going to leave it there. I'm going to say it's been a very busy year. It's been a rewarding year, and I'm much looking forward to the year ahead.
Okay, thank you very much, Sam. Just to add, the last 10 years have been the only 10 years in the 70-year history of the NHS where there's been no body between national level and local level, and a body responsible for coordinating planning, resource allocation and strategic development. And over the years, the numbers have varied of those bodies in England: 9, 14, 26, 4, and now 42. We're the biggest, so we're not imagining that we're going to be merged with anybody else. But our population of 3 million, as Sam said, I think is optimal for doing things at scale. And our population is bigger than 40 countries of the world. So we are the size of a country, and we've got huge potential, I think, to develop and coordinate services for the benefit of those 3 million people in a way that wouldn't be possible if we were a small entity, as has been the case in the past 10 years. So and the other thing to say is the geographical footprint of the North East and North Cumbria has been very stable. One of our staff members, Dan Jackson, who of course wrote the book The Northumbrians, drew my attention to an initiative taken in 1911 to commission Prudhoe Hospital, and that commissioning was done by a body I think called the Northern Poor Law Committee, whose geographical makeup, with a little bit of an exception for North Yorkshire, was almost identical to the footprint that we've got now. So there we are. If we could move on now, David Chandler, to the item 3, the final accounts for the CCGs.
Thank you, Chair. I'm going to do that via a presentation before we get to that point. But I'm just going to take you through a few slides. So firstly, we had the unenviable task, as you mentioned at the start there, of producing and having audited 9 sets of accounts. 1 set of accounts is usually a challenge. 9 was extraordinary. Fortunately, our audit committee chair had been through something fairly similar in his previous career, although his reflection stroke advice, which was along the lines of never again, wasn't necessarily the most inspiring thing at the time. But I have to say, his advice and guidance through an audit process, which was extremely challenging, was really helpful. Key messages from those accounts. So for the 8 former CCGs, which we were responsible for getting those accounts produced and audited, those CCGs delivered all their financial statutory duties, and I'll touch on that in a second, as did the ICB, and the wider ICS delivered a surplus financial position, which was mainly technical in nature, and I'll touch on that in a second. So in terms of the former CCGs, They were monitored as a collective through the first 3 months of the year. We were very much like, if you like, in shadow mode at that point in time. And all those organisations were allocated resources in line from the ICB, in essence, allocation to allocate in equivalent terms to what they actually consumed for the first 3 months of the year. So it's very easy to sort of say that those organisations had achieved break-even, if that makes sense, or easier. In terms of the ICB, as I mentioned, usually when I present each time to the board, we have a number of financial statutory duties. So for last year, for the ICB, for those 9 months, our first one was to make sure that we didn't spend any more money than had been allocated to us. And you can see by that big green tick there at the top right-hand corner, we achieved a small ICB surplus of £2.7 million. So job done on that first one. The second financial duty that we have is not to spend more money on running the ICB than we've been allocated. It's just less than 1% of resources, and we had a surplus there of £5 million for those 9 months. And then the last one is a responsibility not to spend more on capital than we've been allocated. So we were allocated nothing, okay, because traditionally ICBs are not allocated resources spent on capital. That would normally go to provider, but we were also able to confirm we didn't spend any money on capital. So again, that one we were able to achieve. If we also look at the wider picture, because we have the ICB and then we have wider ICS responsibilities, and the ICS in this instance would include our local foundation trusts. So we delivered a surplus this financial year. You'll see there in the narrative a surplus of £56 million. The intention was the ICS would break even. The reason we have a surplus there was very technical in nature, but it related to one of our foundation trusts, Northumbria, and there was an out-of-court settlement for some building work, remedial work that was required, and they effectively won that argument, and an allocation of resources came into that organisation, but clearly they couldn't spend that in a matter of months. That will be spent over a number of years, putting right the deficiencies that were identified in the building. I'm trying to choose my words very carefully so I don't end up in court there, but hopefully that makes sense in terms of why we had a technical surplus there. And then the last one was that the providers generally are allocated capital resources, and I'm pleased to announce again that they didn't spend more than been allocated. They landed that virtually on the button. I mentioned earlier in the board meeting that I was going to show a slide that identifies where the money goes. You know, the ICB, if you like, financial cake, how it's shared across the piece from a system point of view. And what you can see here, the big blue chunk there of the cake on the right-hand side, that's our allocation of resources to acute services. Approximately 52% of our resources in that financial year went into acute. The orange slice of the cake there is what we allocate to mental health services. If I remember rightly, the grey area is community services, and the other blue area is prescribing. And then prescribing only takes 10% of our resources. It's probably the most volatile one in terms of managing. And then you've got 2 chunks of the cake there, which are primary care together, which are the sort of the green and the dark blue one, and they come to around 10%. And then you've got very small slivers of the cake, which are basically other services and running costs. So that's where the resources go to when we divvy them up through the year. Now, I said earlier that the CCG and the ICB had delivered its financial duties, and I gave you an overview of those, which are in all the accounts, and I wasn't planning on going through all the accounts line by line at the AGM. I'm sure you would want me to do that for you today. But you don't just need to take my word for it, obviously, that we achieve those financial duties. We are required by law to have our accounts audited. We have Cameron Wardell with us today from Azars. They led on most of the audits, not all of them, but most of the audits. But I'm pleased to announce that all our audits were issued with an unqualified opinion. And in this case, unqualified is a good thing. Normally qualified is a good thing, isn't it? But in this instance, unqualified is a good thing. In essence, Cameron will keep me right here, but almost like without a reservation, there were no things to highlight to your attention that would make the auditors sort of say, well, actually, we've got a problem here. So so good audit reports from that position. There was one item of recommendation which was around treatment of accruals, estimation of expenditure in some of our former CCGs, and the learning from that has been taken forward from to the ICB. I'll say two more things, if that's okay, which I meant to say earlier on. I would like to give a special commendation at the AGM, if that's okay, Chair, to two of my colleagues, to the Director of Financial Control, Richard Henderson, and Anthea Thompson, who works with him. They put so many hours into making sure we produce the accounts, and I know Mazars also put an awful lot of effort with other auditors, but mainly Mazars, in terms of working with us to get our accounts audited and submitted in good time to NHS England. So I just think it'd be remiss of me not to mention those. The last thing I was going to say is, if you are interested in seeing copies of our annual report and accounts, there is the link. You can easily find them on the website, and the more details in there in terms of those accounts detail. Okay, that's all from me, Chair.
Thank you very much, David. We've got, would it be better to take the external audit opinion now?
Well, what I would say, Chair, is we've had the accounts, they've all been submitted, they've all been audited. This is, if you like, just presenting them to the AGM. Cameron was with us. He might want to say a couple of words or take any questions.
Could I invite you to do that, Cameron? Thank you.
Just to basically reiterate what David said, it's a bit of an unusual year from an accounts production and an audit point of view, where you've got 3 different audit firms essentially auditing the same organisation 9 times. Yeah, that's right, actually. So we obviously did 6 of those things, but we did have to rely on the work of the other 2 firms in relation to the audit of the ICB itself. So as David said, a few of the audits were a couple of days late, but a couple of days in the context of that situation. As David also said, all of the opinions on the accounts were unqualified, which is a good thing. And he's stolen my joke. I have to point that out. And other most important thing, I think in the context of a 9-month period for the ICB, we didn't identify any significant weaknesses in the arrangements around about value for money. And that includes looking at the former 8 CCGs and the ICB. And just a reminder, that covers the governance arrangements. It covers your financial sustainability arrangements, so medium-term financial planning, budget setting, etc. It also covers the way that you work in partnership with other organisations as well. That's clearly something we'll be revisiting in 23, 24 and in future years as your auditor. But I think a positive message from external audit in the first year of the ICB as well, Chair.
Thank you very much indeed. Sam, back to you for the ICB annual assurance letter.
Thank you, Sir Liam. So NHS England has a legal duty to undertake an annual assessment of each integrated care board and their performance, and this is a requirement of the Health and Care Act 2022. So the papers today that we've published include in full the assessment that we have received from NHS England on us in our first year. And I as the Chief Executive of the organisation, I was pleased to receive this assessment against a number of duties. It recognises the approach that we've taken from a system leadership perspective, how we've approached the improvement in the quality of services and the oversight framework that we've devised, working collaboratively with our partners in the system, how we've undertaken our financial duties in the first year, and also our focus on reducing health inequalities. And you'll see in the letter it sets out all of the steps that we've taken in our first year with our health inequalities, Healthier and Fairer Outcome programme. It also comments on our approach to using evidence and facilitating research alongside the decisions that we're taking for our population and patient and public involvement. I do want to also just speak briefly about the final section of the letter, which NHS England did seek feedback from chairs of health and wellbeing boards across the system on our contribution to wider strategies. And you'll see in their assessment, our partners have acknowledged our work in our first year that we've undertaken jointly, and also commented that through our second year they want to see greater alignment with our work between the strategies in the North East, North Cumbria, and those that are being delivered through the integrated care partnerships. And I know when we next have our strategic integrated care partnership in December, we'll get an update from the 4 chairs of our 4 area integrated care partnerships across the North East, North Cumbria, and we'll ask them specifically to report back on how we're doing with that in our the first half of our second year as an ICB. So the annual assessment, I would report, I think, is a positive one. It does capture an independent view of NHS England on our first year operation, and it is appended here today with the AGM, and that again is a requirement of every ICB to do that. So Liam.
Thank you very much, Sam. I'll pass over now to Claire Riley, our Executive Director of Corporate Governance, Communications and Involvement. Item 7, have we received any questions from the public?
We've received no questions on the agenda items today, Chairman.
Okay. And then I think you may have some reports available, have you?
Yes, we've got some summary reports of the annual report and accounts. I have some here, or there's some at the other side of the room, Chairman.
Okay. And could I, in addition to David's thanks to his team, could I also thank you, Claire, for your team, to Deb and everybody else for preparing the annual report and preparing the arrangements for this meeting. So thank you. Good. So the meeting's closed. Thank you.